Bonjour tout le monde. Can everybody hear me if I speak here? Okay. So I realize that we're running a bit late on time, and I have a lot of slides, but hopefully it'll be entertaining enough that it'll keep you awake. So now for something completely different from what we've been hearing about. The research that I do is very different from stem cell research. I study people. So I'm an oncology nurse, and I made a career switch to the darker side, to the research area. And so for the past 15, 20 years or so, I've been doing my research, a clinical program of research on studying how people experience cancer and how they're able to live with the uncertainty of cancer. So in this kind of a forum, I wanted to thank I'm very humbled, and it's a privilege to be presenting among patients and family members, because most of the research I do is with patients and family members. There's a lot of patient engagement, and it's the ultimate test when your research is presented back to patients and families, if it has validation to them and if it has relevance. That's really where our research money should be going to. So for the next hour, I'll be presenting some of the research I've been doing on how to, what I've learned from patients, and how I've been able to bring what I've learned in research to patients and family members in a clinical setting. But first I'm going to lead you through the evolution of psychosocial oncology. This is a field of research that I do. So our understanding of cancer and our response to cancer, it has changed over time. Our association with cancer, we immediately think of pain, suffering, and death when we think of cancer. And this association dates back to the early 1900s, when cancer was diagnosed late. Treatments were very primitive. They did purging, and if you're really interested in the history of cancer, there's a great book that I can refer to you after. But when cancers are diagnosed late and treatments are very primitive, people died a horrible death. And this is the first association with cancer and pain and suffering. And much of the literature after that came in the form of the 1950s and 60s. We've been hearing a little bit about that. Even when chemotherapy, radiation therapy, these were being discovered, a lot of the research and the patient testimonials were still associated with the negative side and the harrowing adverse consequences of cancer. During the 1980s, medical treatments advanced rapidly, and then the side effects were being better controlled. Cancers were diagnosed earlier, and the mortality rates started to drop, so that people were not suffering as much because of advances in cancer treatment and better cancer control. So we started to see a shift in the research in psychosocial oncology. And we started to see there was this other side to cancer that was being talked about by patients. This other side of cancer, which we know now is very social and is very articulated. And it became more acceptable to talk openly about cancer in our Western culture. And then we also saw this terminology, and this new terminology of resilience, post-traumatic growth instead of post-traumatic stress disorder. And all of this was the area that fascinated me, because when I was working at the McGill MUHC, I took care of bone marrow transplant patients, and I saw also from my own practice that some patients did so well and adjusted so well with their cancer diagnosis and their management, and others needed much more support. So I wanted to learn. My whole program of research was then to learn from those who are resilient. What do they do? What do they say to themselves? How do they cope? And then if I can learn from them, then I can begin to help other people who are having a more difficult time. So that spawned about a 10, 15-year research career. And about 2 years ago, I had the opportunity to put this research that I've learned into practice. And so now I lead a monthly workshop at the hospital where I work, and it's about a 3-hour-long workshop, weekends, sometimes during the weekdays. I have about 3 to 8 patients come in, and we talk about the people, their journey with cancer. And I do have, and it's all based on the work that I do that I found in my research. So much like any other workshop, I usually begin with introductions. I ask people to introduce themselves and tell me something about themselves so that we can start to bond, and we're going to be telling each other stories so that we feel comfortable. So, hello, I'm so-and-so, my name is, and they say their diagnosis. They list the surgeries that they've had, the tests, the treatments that they've had so far, how many more chemotherapy sessions or radiation therapy sessions do they have left. By the 3rd or 4th workshop, I started to notice this trend, and I decided I had to stop this trend because during the introductions, I was listening to how cancer was being treated. I knew nothing about who the person was. And so when I started to do these workshops, what these introductions taught me was that cancer is perceived to be such an overwhelming and large episode in people's lives that it overshadows what makes them who they are as human beings. And it robs people of the essence of what makes them uniquely human. So we no longer, cancer, it is, I don't want to minimize it, but it really takes over people's lives. And it gives them that sense of what used to give someone a sense of meaning or pleasure. There's no longer any time to do that. And people forget what makes them uniquely human, and they forget why they're doing the treatments for. It's all about survival, but what are they surviving for? So whether we like it or not, whether we're prepared or not, the cancer journey makes us confront our own mortality. It opens the door to these bigger questions about life, about these existential questions about who are we? What do we want to do out of our life? What legacy will we leave behind? Were we satisfied with the life lived? And how do we want to spend the rest of our days? So often, when someone is diagnosed, things happen so fast. And we heard that from Mai this morning, where she was diagnosed, and everything happened within a span of 5 days. And often there's no time to talk about these important matters. And it's often very discomforting or uncomfortable to talk about these big issues. It's that big elephant in the room. And so these elephants they're in the hospital setting, and they also are at home when you go home to your family as well. So how do we actually address these big existential questions that we all think about? So patients tell me 90% of the time they're able to function adequately. 10% of the time, maybe they can't sleep at night, or they're waiting for a test result. This is when those big existential questions start to arise. How do you deal with that? So what patients have taught me was that the journey of cancer is as much about the clinical treatment of cancer as it is about losing and recreating your identity as a person with cancer. Understanding the journey of cancer is about understanding yourself, your relationships with other people, and how your life is irrevocably changed by that cancer diagnosis. But as large as that elephant is, being diagnosed with cancer does not define who you are. Cancer may be a very large presence in your life right now, but it's not all that you are. And that's the message that I say to patients when they introduce themselves around the workshop. So there's many ways to define personhood. And in the field of psychosocial oncology, we like to kind of decorticate the person. And we study a person. Researchers like to use circles and pretty colors and compartmentalize the person. So we study each part of that person in isolation. Then we use these circles and arrows to connect all the parts together. But so we know that there's a psychological, cognitive, social, spiritual, biological, clinical, behavioral side to a person. But the definition that I like, and I was trying to take a picture of you guys. I don't know if you saw me try that, but the internet wasn't working. I was supposed to have a picture of you in the audience shown back at you, because the person of who you are is who you see in the mirror. And you're the only one who can define who you are, what you believe in, and what matters to you most. So one of the other things I do in my workshop is I have this object exercise. As people come into the room, they choose an object, and then we use that object to describe who they are. And invariably, a lot of people gravitate to stones, these river rocks, but everybody has a different interpretation of what it means to them, and that interpretation allows me to have a glimpse into what is important to that person. So that's where you see the person coming out, regardless of that cancer diagnosis. So the message there is that things, events, situations have no meaning until you give it a meaning. And it's the same with the cancer journey. The meaning of the cancer journey is what you assign to it. And what my research has done is to try to understand how people understand the overwhelming nature of the cancer journey. How do they assign meaning to what they're living through? So to understand that, you have to look at what life is like without cancer. So when life is good, we usually don't have the desire to look at and do that hard work of reflection. Some researchers propose that how we cognitively understand and process a traumatic event ultimately affects how we respond to it. So when we're healthy, we have our routines, there's usually no time to contemplate these big existential questions. Our routines actually give us this sense of control, familiarity, certainty, and comfort, and predictability. And these are and then it gives us goals that we want to work towards, and it gives us a sense of order and purpose in life. But then, if you really think about it, these are just illusions. You really don't have control. You can't predict the future. But this routine allows you to think that you do. And that's really key, because you have you build your self-esteem and your sense of meaning in life. But to date, it's implicit and not analyzed. What happens when a person is diagnosed with cancer or experiences any other life-threatening event? So all these little circles of physical, psychological, social, financial, these are all impacted. All different domains and dimensions of your life is kind of turned upside down, and people have to take stock about each aspect of their life. So when cancer is diagnosed, cancer shatters these illusions, and it's hard to stare at your own mortality. What happens is that you don't have that sense of routine anymore. Your objectives are questions. The predictability, control are taken away. So you're left with a sense of uncertainty and vulnerability, and your self-esteem, your ability to master things. All these start to get shaken up. What happens is that what I try to do in my research is to understand how people are able to understand what is happening in their life. And when I did my research in the beginning, I did a lot of interviews with patients at different points in their life, at diagnosis, during treatment, and even into survivorship. And what I did is I looked at thematically how patients were able to find a sense of meaning in their life. And this is what I came up with. I developed this intervention called the Meaningmaking intervention, and it's so simple but a lot of the patients that I've talked to, they start off with talking about their life before cancer and life after cancer. And the first thing that we do is that we start talking about the present time, and to tell me a story about what the day of the cancer diagnosis was like for you. And a lot of the patients remember that day with such vividness. It's incredible. They remember what they felt. They remember what it was like outside, how they got home, who they told. And that was there's a reason for that, because as they tell their story, what I'm listening for is that the story feels as if it's an overwhelming darkness. But what I'm still listening for and relating back to them is that there are some aspects of their life that is still under their control, and that there are some things that have not changed. So there's a reflection back to them to do that kind of work. And then it's to show them that there is a balance in their life as well, that there is possibility for negative and positive to be present in their life, even with the diagnosis of cancer. And that's helpful to reflect back, because it may feel like it's just one big enveloping darkness. The second session is to look in the past, and these patients are invited to look at and talk about different past events that have happened to them in their past. And the point of that is to identify and to reflect back that these events, they may have been unpredictable, they may have been I guess, uncertain. There's so much uncertainty during that event as well, but they were able to come through it and master it or learn from it. And so as they're relating that story back to us, then what I'm trying to do is to seek out the strategies, their coping strategies, their strengths, and to relate it back and say, you were able to do this, and those strengths and coping strategies may be able to help you deal with the cancer that you're currently facing. And then it's only then that we start to look at the future, because this is the most scary aspect of people who have been diagnosed, because it's very uncertain. And only when they're able to come away with thinking, oh yeah, I have been able to cope with some of these unpredictable, potentially large events in their life in the past, that they can start to look forward and look at some goals that are as important. And that opens up a conversation about what goals that they have for the next day, for the next week, for the next month, so in more manageable portions. So that was one-on-one, face-to-face. What I've been able to do now is to put it into a book, write it up as a book, for patients to self-administer this meaning-making intervention. And so there's a little bit of theory in the beginning, and then later on there's a lot of, it's interactive. People write into the book, and it's all questions. And it's as if I was asking the questions next to them. And it's all the chapters in the book, or each page, these are have been related back to me by patients themselves who said these were pivotal moments in their across their cancer trajectory. So I've been able to do about 10 years of research on, I did a randomized controlled trial, and that had been shown to increase patients' sense of optimism, sense of self-efficacy, and self-esteem with the meaning-making intervention. That was face-to-face. Then I've been able to start doing some knowledge translation studies where we look at the self-administered, the effects of self-administering that kind of intervention in the book, and now I've been able to move it into workshops. So this is just different ways to present the intervention. It's been animated by an oncology nurse, a psychologist, an drama therapist, an art therapist. So it's teachable to other interventions, other healthcare professionals to be working with patients and different contexts. It could be in the clinical setting, it could be at home, and then currently also in the cancer center where I work now. So I do a lot of mixed methods studies, and what I've been able to show is that face-to-face, or when we're working in a workshop setting, if there's interaction with another live person, we found statistical significance. But if it was self-administered by a person just writing in a book, we didn't find statistical significance. Now, one of the reasons is that I think about this is that what we saw in the self-administered version of the workbook is that there was a lot of movement, and maybe we needed to just test it and make more assessments a little bit longer in time, maybe not immediately or 1 month after they work on the workbook, but maybe a little bit later, and maybe it takes time to process what you're going through. So I'd like to go into some of the themes now. What did our research show? And what I wanted to show you here is that a lot of the patients talk about the existential slap, because most of the people do not think about their mortality. And what we've been able to see from people who have written in the book is that they may not have verbalized it to other people, but they all wrote that the first thing that came to my head when I received my diagnosis was, will I die? How much time do I have? I was scared. There was a lot of uncertainty. Why me? Why now? And so that is really across the board. The other thing is that what we've seen in the themes when we did some of the content analysis is that there was a whole gamut of emotions. People did not have just stay with fear and the negative emotions, but they were also showing signs of resilience. There was a lot of self-talk about you have to stay calm. There was fear, but then other patients were talking about and talking to themselves about, I have to accept this. My first thought was that sometimes there's some dark humor involved. This person was saying that he had pancreatic cancer, and at least this will be a fast death. I mean, there's a lot of these different kinds of emotions that run through people's heads when they're first diagnosed, but they may not have verbalized it. But in a workshop setting, they do talk about it, and they're able to share their experiences with other people. Another theme that came up that was very, very strong amongst all the patients who wrote in the workbook was that the importance of family and the importance of connecting to other people. And so when they were first diagnosed, their first thoughts that came to their head was also that they didn't want to be a burden to their family. They may not have enough time to spend with their family. Or they felt proud to have raised 3 children in the way that they thought that they had good values. And so the family theme came to be very important for patients. And this I found was important because this person was saying that if they can't control the actual diagnosis, they can control other things in their life, like, for example, they can control who they speak to and who they can turn to for support. And there's just so many different quotations about the importance of family, and who do they not tell. The reflections on the past, what we found as a very common theme is that when they reflect on the past, they see that their lives were going 100 miles per hour. They were being, we talk about routines and how things just happen rapidly, but we don't really stop to think about our lives. So this is really, it supports that idea that theoretically, these are actually quotations from patients. They never had time to do the little things or to take care of themselves. And this other quote here they talk about when they were given that diagnosis of cancer, what happened to them. Their life stopped, and then they became less tolerant of things that bothered them. They were more sympathetic and empathetic to other people, but really they were just starting to think about themselves and how do they want to spend more time in a meaningful way, in a fulfilling way. So in the workbook, patients would also talk about relating past and present. And this gives them a chance to make those connections. And I said, again, during routine life as well, you don't have really that opportunity to stop and reflect. So this person had grown up, this was a quote from a person who had to take care of his brothers and sisters since the age of 11 years old and never really had a chance to have a childhood. So this person was actually saying that I need to start to take care of myself and profiter de la vie and do things that really are helpful for himself and protect himself. And it was only the diagnosis of cancer allowed him and gave him permission to stop and do this for himself and take care of himself, put himself as as priority. So this person was saying that it was a good exercise to look to the past and connect to the future, to connect to the present, because it gave them a time to stop and pause, to realize that he had a good life before cancer. This is a person I thought that was very poignant, who gave this quote. I moved out the details in the middle, but this person was saying that she didn't really want to do this exercise in the very beginning, because she didn't really think that she had much to think about. But after she did the exercise, reflecting on the past, she had so many different life events that had happened to her, which I had blocked out. And then she had her diagnosis of cancer, and that was really difficult for her. But then she said she had forgotten all of those different life events that she had actually coped with, and she had forgotten about. And the fact that she was able to relate this now, and it came back to her memory, and she thinks that maybe in 5 years from now, this cancer diagnosis may be something that she will also surpass, and it may be another life event that she can look back on because she had coped as well. So I don't know how much time I have. So this is a patient who we start looking towards the future, and some of these quotes were saying when they start to look at their current situation and looking to the future, how do they want to spend the rest of their days? I'm not going back to work. I'm not going to be Mother Teresa anymore. I need to start taking care of myself. I have to live more intensely in spite of the illness. I have to take care of more of my family. I have to not to ne pas s'inquiéter des choses qui sont hors de moi, not to, anyway, you can read that. Sorry, I'm not going to go through all of them. But it's really to seize the day. And this person actually had a tattoo, Carpe Diem, to seize the day, to live in the moment. And this is something, the theme of living in the moment, of being appreciative of the moment, because this is the only time that you have that is within your control. Looking to the past is the past that it's over. You can learn from the past, but to look into the future, nobody knows what the future is in the next month or days. So they're saying they have to start to look one day at a time. And really, we say that a lot, but there really is some truth to that. And then they have changes in life philosophies as well. So the life philosophy is that when they look back at their life and take stock of where they've been, they invariably start to say, I didn't realize I was that strong. And this exercise of being able to reflect allowed them to realize it for themselves. And then what they also saw was that in reflecting back on their experience, that there are so much compassion from other people, altruistic people who were able to just come, strangers who would be able to show a kindness to them. And this really helped them balance the darkness of their life, of their cancer trajectory. So these, I'll let you read this. It's really about looking and appreciating the moment now. And there's a lot of literature about mindfulness and awareness of living in the moment. So these are all quotes that I've taken from the patients' workbooks. They keep their workbooks, and I make photocopies. But these are words of wisdom from people who have lived their cancer or are living through their cancer. And it's I think those are powerful words. If patients can speak to each other, and this is what I try to do in my research, is to learn from people who are living with cancer and to see how they're able to live well with cancer and adjust and impart it back to other patients and family members. So I think a lot of the themes are about accepting what you have. Maybe there is a reason for it. Maybe you might not know the reason now, but you may understand it later on. And to remember to dance in the rain, even to dance in the sunlight, even though it may not be sunny outside. Some of these quotes are just amazing from patients. The last one here, je n'ai pas de forte conviction, but there is an exception. I don't have strong convictions, but I have one exception. I've always been lucky in my unluckiness, and maybe this will help me this time as well. So it's about learning to dance in the rain, I think. And these are just such words of wisdom that is amazing. So, you know, what the literature in the field that I do, in the research I do, they talk about the form of resilience. There's 4 different kinds of resilience. And there's this, and I use the analogy of a tree in a big storm. So this is where a person can function normally in periods of stress. So a person can come in for chemotherapy and go back to work. That's one form of resilience that we see in our cancer settings. A second form of resilience is when a person is able to make temporary changes in their life and in light of the stress, but then they were able to revert back to their normal life routine. So we see this a lot, and I think this is the most common type of resilience that we see. Patients come in for chemotherapy, and by the 3rd week or so, their resilience comes back, you know, and they're able to resume a normal life again. There's a third type of resilience where there's permanent changes in a person's life, and they're able to assimilate that stress into their pre-existing life routines, but they've made complete changes. This is what we talk about finding a new normal. And patients are able to talk about how they've incorporated what they've learned about themselves during the cancer, during their stress of receiving chemotherapy, radiation therapy, surgery. What they say is that they started to walk maybe, or they started to eat healthier. They've made certain changes, but now they've incorporated it into their life, and it's become a permanent part of their life. So that's a different type of resilience. And then the post-traumatic growth type of resilience is where they take their experience and they're able to teach other people, and they have I'm sorry, they got all changed up here. It is an Apple computer, right? So they have emotional changes. They have a changed life philosophy, and they're be able to see more compassion in other people and are able to give more compassion to other people. So they're using their experience of having cancer to see life in a different aspect, in a more positive, in a growth, developmental way. And so the bottom line is that the research is showing that this type of reflection, cognitive and emotional, is very beneficial for patients. And you can do this kind of cognitive reflection by talking to other people, by writing, and by art therapy as well, and by drawing. And I think on TED Talks, there's this TED Talk that talks about how this woman was able to surpass her diagnosis with cancer by dance. So it's a way of expressing your emotions, being in tune with who you are, and researching your identity as a person and finding that growth. But what we also know is that it's hard work, and it is an emotional experience. So you have to give yourself permission to take pauses as well. And what we generally recommend is that when do you know you need to take a pause? It's when the intensity and the duration of that distress, it starts to interfere with your functioning over time. And that is when you start to need to seek out extra assistance from a healthcare professional or not. But by and large, people are resilient. It's in our nature. It's in our nature to find a sense of meaning for why we're here. So there are some unanswerable questions about why did we get cancer or not someone else. I mean, those are you'll never find answers to that. But to be able to apply a meaning to your experience, then that is within your control. And you are the experts of your journey. And collaboration is really important. One size doesn't fit all. You live more at home. You spend more time at home than you do in the hospital. So you need a whole toolbox of different coping strategies as your situation changes. But you are the person who will self-manage your cancer at home, in the hospital, different situations, different times. The oncologist, the hematologist, the psychologist, all the cancer care team, they are experts in treating the cancer, but you're the expert in treating your own life. And that's the end of my talk, and I'd be happy to take questions.